be working to unwind the sort of testing psychology that our federal leadership has managed to, unfortunately, get most of the country in over the last 2 years.
Unwind the testing psychology, which is alive and well across this country right now. That was Florida's Surgeon General saying that if you have no COVID symptoms, you should not get tested to free up more tests for the people who are at higher risk. He says testing healthy people could actually do more harm than good in some cases, but the CDC says you can be contagious before you're showing symptoms. So we're glad to be joined now by the Florida Surgeon General, Dr. Joseph Ladapo, who joins me now. He holds degrees from Wake Forest University and Harvard Medical School, where he received his MD and a PhD in health policy. So, Doctor, thank you very much for being with us today. As I mentioned, you've gotten a lot of pushback. I'm sure you've gotten more attention than you anticipated based on that comment. Here's somebody coming at you, another doctor who was on CNN. I want to play what he said and give you the chance and opportunity to respond to what he says. Watch this.
It's hard to believe those comments came from the Surgeon General of one of the largest states in this country. And you're trying to keep businesses open without testing. You're allowing the virus to continue to spread unabated. So, if anything, we need to do much more testing, not bury our heads in the sands of Florida and hope for the best.
Doctor, welcome here. And what do you have to say to Dr. Renner?
Oh, thanks for having me on. Yeah, so I think if you listen to that doctor's words, you'll actually hear the answer to the more important question that Americans need to be asking, which is the best way to approach this pandemic. So you just heard that gentleman say that you need to do more testing. So, look at the totality of evidence that we have right now. I mean, how is more testing the answer to a surge that is very obviously outstripping our ability to trace it and to keep up with it? I mean, it's sort of ridiculous. It's kind of a pattern that we've seen the whole pandemic. When a policy doesn't make sense, whether it's the mask mandates or now the vaccine passports, when they fail, people are doubling down and tripling down. It doesn't make sense. And I hope more people realize that these policy proposals are total failures. So instead, what we're shifting toward here in Florida is to remind people something that everyone knew before the pandemic on the clinical side. All clinicians knew this before the pandemic. It's what's happening now. That's what's abnormal. That's what's new. So we test to improve outcomes. So if a test is likely to improve a patient's outcome, that's a good reason to do a test. If a test is unlikely to help, if a test is unlikely to change anything, then, what was the value of that test? The test may not have had much value. And that's what we're trying to come back to.
So I understand, if someone has mild symptoms and they're going to get over them in a few days, I understand where you're coming from, where for that person, what difference does it make whether or not they're tested? The treatment is probably going to be the same either way. But the question, I think, comes in for people who aren't showing symptoms yet, but may be contagious, and they might be around a grandparent or a vulnerable person whose health is compromised, and that person, because of that, might end up hospitalized.
Right. So, Martha, allow me to help sort of unwind some of the beliefs that, unfortunately, our federal leadership has just convinced so many Americans is true. So first of all, the idea that stopping the spread of a virus is the objective of a public health campaign when, probably somewhere around half or more of people with that virus have no symptoms whatsoever, that's completely specious. That should never have been something that the federal leadership convinced Americans that was possible. So really the question, the scenario you laid out, it's actually not quite the right scenario in terms of thinking about what the objective is, which is to spend time with grandma or grandpa. And so in that situation, think about your options, right? If you're concerned that you have symptoms, you might be ill. Maybe it's not the time to spend not the time to spend close contact with someone who's vulnerable. If that person doesn't have a history of natural immunity, well, there are vaccines available if that individual has concerns. What else do we have available? We have treatments available. So this is a healthier, more sustainable approach rather than, unfortunately, again, the federal leadership and the public health leadership and being successful in convincing Americans that their responsibility is to sort of forever try to detect asymptomatic disease. It's just completely unrealistic, and it's very obvious that it's failed. We need to focus on treating people who are ill, and we need to focus on getting on with living, because we're stuck in a rut with this sort of preoccupation with building our lives around COVID.
Well, I know Governor DeSantis has said that it's not good to use testing as a tool to limit opportunity in education. And I know you guys are on the same page. Dr. Ladapo, thank you very much. I hope you'll join us again with a different take on this. It's interesting to note that Britain and Israel are saying that you don't need a PCR test. If you do a home test and it comes up positive, then you should trust that and leave the PCR test for people who need them. So maybe you're on the edge of the way other countries are starting to approach this as well.
It's a sustainable way to approach it. And again, we're not restricting access, but we're saying let's try to focus testing on where it can actually improve a patient's outcomes.
Thank you, doctor. Good to see you today.
Thanks.
Thank you, sir. Dr. Joseph Ladapo.